Hello and welcome to my first aid kit. This first aid kit is designed for a camp counselor or someone on a hiking trip, boating trip, or just some outdoor activity. It's relatively light, so it should fit in any camping bag or in the camp counselor's office. We're gonna get right into it. This kit is designed for environmental emergencies, sudden illnesses that may come on, as well as immobilizing a limb, joint, or a bleeding emergency as well. So we're going to start right up here. In this corner we have lozengers or cough drops. These are for obviously helping relieve throat pain, but it could also help someone suffering from hypoglycemia. This is the loss of sugars in the system, not having enough sugar to keep the body active. Some of the symptoms that would be showing for this include dizziness, an altered mental state, drowsiness, along those lines. So one of the first things I would do before administering these to anyone is to make sure that they're a registered diabetic, and making sure that they're also awake enough to take one of these. The rule of 15s is basically administering about 15 grams of CHO, or like a sugar or carbohydrate, waiting 15 minutes for that substance to kick in and to see any signs of that person's mental status to change, where they're getting better, they're getting less dizzy. If after 15 minutes there is no change, I would administer another 15 grams of sugar to them. Still no change, activate EMS, because that person is not getting the sugar sufficient enough to help them, and they need more help. They need additional help. Right next to them they have rubber bands. These are for administering, for me, I think immobilizing a wound. Specifically for rubber bands, I think fingers, if there's a broken finger or sprained finger, dislocated, I would definitely make a makeshift splints, probably using sticks, just because that's what will be available, or maybe even if there's like wood shavings, really, really thin ones. Even popsicle sticks, if we have popsicle sticks on us, I would put one on either side of the finger, checking CMS before applying the full splint, and then wrapping the rubber bands around the popsicle sticks, checking CMS again after applying the splint to make sure that their capillary refill is still coming up normal, and to make sure I didn't do it too tightly for them. Right next to rubber bands we have forceps or tweezers, used for a variety of reasons. That could be pulling a splinter out of someone. In this case I put these in here for tick bites specifically. Ticks are really, really pesky, and they can even admit Lyme's disease to someone, specifically wood ticks and deer ticks. So it's very important that you get medical attention, or you see medical attention maybe after getting a tick bite, especially if you don't know how long that tick has been on there for. For tick removal, just take the forceps, carefully pulling at the tick on the skin, and then once you do pull the tick out, make sure that the whole body of the tick, head and legs, come out with it. Right next to our forceps we also have a thermometer. This I would use to check someone for heat exhaustion or heat stroke. Although they sound similar in names, heat stroke is a full medical emergency that needs to have an activation of EMS. Heat stroke deals with about a 103 to 104 fever. So this is an oral thermometer, which means that it's going to be about a degree off of the actual temperature. So if that person that I that victim that I address and I check their temperature and it comes to 103, that's telling me they either have a 102 or 104 fever. So that is an immediate activation of EMS. Another way to tell if someone is suffering from heat exhaustion compared to heat stroke is to check their skin. Whereas heat stroke, you'll find red, hot, dry skin. Heat exhaustion would mostly include like a damp. There's still water coming up. There's still sweat being produced by the victim. So they'll have clammy, warm skin, whereas someone suffering from heat stroke will have red, hot, dry skin. So that's another thing to look out for. For someone suffering from heat exhaustion, I actually have an ice pack here. I would be careful with applying an ice pack just because of afterdraft. That's a situation where the cold blood can pump back into the heart too quickly. And it's just that circulation of really, really cold blood just really isn't good for the heart, and it could cause an even more serious medical emergency as well. So that's everything on this side of the wall. Over here we have some of our ointments that we would help treat if someone got an abrasion, if someone had a nasty run-in with some poison ivy. That is where we would use some of our ointments and our sterile prep pads. So over here we have hydrocortisone cream. This is something I would apply to someone who I believe has experienced some poison oak or poison ivy. They may have a rash. They may be telling me that they're itchy. So I would apply this cream to hopefully alleviate some of that itch. Here I also have a plant identifier handbook. It's to help me identify maybe what they might have come across. So let's say they bring me to the location and they show me the plants that they were playing in. I would hopefully be able to identify and be like, yep, that's poison oak. This is how I want to further treat that. So that is why that helpful little handbook is in there for me. Along with the hydrocortisone cream on this side, we have sterile alcohol prep pads. This is something I would apply to someone who has an abrasion or a minor scrape, just to kind of clean around the wound a bit before applying my triple antibiotic cream. Apply this directly to the wound. Obviously, if it's an open wound, apply PPE. Get your hands covered in gloves. You don't want to have any type of blood transfusion to yourself and possibly injure yourself. So apply PPE obviously before addressing any open wound situation. Right next to our antibiotic cream are gauze pads. If the wound is a bit more severe, I definitely recommend addressing a gauze pad to it as well, just to further keep it contained and just out of the way of any foreign objects that could get in there. I also have roller dressing as well as a roller bandage in here for anyone suffering with injuries that would require a bit more pressure. Over on this side, we have Band-Aids, different sizes for depending on the size of the wound. Again, before applying bandages, prep pad, ointment, possibly gauze if you need it. But the Band-Aid is really just there to, again, keep that wound from having any foreign bodies enter it after cleaning it. Right next to my Band-Aids is a plastic card. This is specifically for sting removal if one of my campers were to be stung by a bee. I would remove it with this card, the stinger that is, get it out of their skin, address it with sterile prep pads, and then maybe a little bit of antibiotic cream as well as a Band-Aid. This could also require help with a cold pack as well to just kind of keep the swelling down, as sometimes bee stings can be a bit painful, especially for younger campers. once again, kind of addressing heat emergencies, we have sunscreen, because if you're going to be outdoors, you're going to be exposed by the sun. So we have sunscreen as well as aloe cream in case sunburnt does come up and someone does get a red color to their skin and it's a little irritating. Definitely apply some aloe. Also in here we have cravats and a tourniquet. Cravats is what I would use for a victim who comes to me with a possible broken limb, whether that be their arm or their leg, a toe. I would use this in making a makeshift splint for them. Let's say that they have injured their arm. I would maybe get some sticks on both sides of the arm, watching the wound if there is an open wound there, and I would apply the cravats to secure that arm and make sure that it remains immobilized. A tourniquet is what I would use if I am approached by someone who is profusely bleeding. I use every ounce of dressing I have. If nothing is stopping this bleeding, I am going to apply a tourniquet, specifically right above a joint area or right below a joint area if I can help it, not directly on the joint. And I will do that as tightly as I can, or until I start seeing that blood trickling slow down a bit and become more controlled. Right next to the tourniquet, not sure if you can see it, but there is a small little handbook for emergency contacts for my campers. If anything were to happen to them, I want to make sure I have this handbook on me so I can contact their family members, say, hey, little Jimmy got a little bee sting, just wanted to let you know he is fine, but this is what happened to him today. So I want to make sure I have this handbook in there to let their parents know if anything would occur. Next to this handbook is a satellite phone. The satellite phone, if I'm off grid, I want to make sure I have this on me to report an emergency if one does arrive and I need to activate EMS. If I can get it out of here, that'd be awesome. There we go. So satellite phone also comes equipped with a flashlight. If I need to see into someone's wound more, make sure that there's no foreign objects in it, as well as maybe a tick that is being extra persistent and isn't coming out of the skin all the way. This flashlight will help me identify and hopefully remove it properly. Right next to the phone is my CPR breathing mask. This is in case someone does become unresponsive, no breathing, no pulse. I have a full CPR mask in here for that victim and to protect my own self from their possible germs. In here is also my PPE, as well as a sterile prep pad. So if anyone was to become unresponsive under my care, I have this in order to help me safely address them. Again, we have that cold pack for stings, swelling, heat exhaustion, and then next to that we have a notebook. This notebook would be helpful for me in case something were to happen. I was approached and given a lot of information. I want to make sure I'm able to give that information to other first responders or EMS personnel, so I would want to write everything down that I'm given into this notebook. Obviously I have a pen in here as well for that. So kind of going off where we just left off, we have our notebook where I will write down and record anything that an individual tells me about their condition, and right next to that we have an EpiPen. Make sure the EpiPen is not expired. If it is expired or approaching the date of expiration, that could affect the serum within the EpiPen. If it is an EpiPen emergency where anaphylaxis is diagnosed, and the person is going into anaphylactic shock, immediately call EMS. The way you administer an EpiPen is you're going to take off the cap, insert it into the thigh, wait about 10 seconds, and then rub the serum into the thigh to make sure that it is in there. The reason you do puncture the thighs because there's a lot of muscle in there. You won't really hit any arteries with that needle, and it's just kind of the safest place to apply your EpiPen. Right next to the EpiPen is some feminine hygiene products. These are for my young campers that may be experiencing menstrual cycles. Want to make sure you have these on hand for them, as well as yourself. Right next to that is some Tylenol, just for pain relief. Give at least like maybe 1 or 2. I don't really like giving out 3 of them. Just 1 or 2 should do the deal. Maybe 1 more if they're still complaining about pain. Right next to that is my soap and water solution. This is just what I would use to help flush out that wound. Make sure that there are no foreign objects still in there before wrapping that up with some sterile gauze and roller bandages. This is my roller gauze. This is what I will apply as an extra dressing to make sure the bleeding kind of subsides and stops, hopefully. And then right next to that is my roller bandage. I will use this in situations where I want to cover up the roller gauze, or if I am suspecting anyone of a snake bite, I'm going to use this bandage instead of roller gauze because it is a bit more adhesive and it will wrap tighter and provide more pressure, which is good for dealing with snake bites. Right inside of that roller bandage, is a razor. We have an AED on our campgrounds, so we want to make sure that if there are any kids with a hairy chest or any adults with a hairy chest, that we remove that hair before applying the AED pads, just to make sure that the pads can stick properly to the skin. Right next to that we have some scissors. These can be used to remove any clothing, cut more cravats with our dressings, or just, cut restricting clothing and or gauze into smaller pieces. Right in here, it's very hard to see, is some medical tape that I have for my gauzes, and just making sure that everything stays nice and intact and adheres to the skin. So that is what the tape is in there for. And then right up here we have our slings and swaths. This is used obviously for immobilizing, maybe if someone came in with a dislocated shoulder. That is what I would use this sling for, as well as our cravats. And then right under that is an emergency blanket. This can be used in hot or cold environments. For a hot emergency, so someone suffering from heat exhaustion, I would apply this, maybe put some water on it to get it cool and damp, and then apply it to the victim. And then right over here, I hid it, is a little stress ball. So I would give this to my young campers who might be a little scared. It's just going to keep their minds busy as I treat their wounds. And that, I believe, is everything within this first aid kit. Thank you for following along, and stay safe. Hello, sir. May I assist you?
Yes, please.
Okay. Can I ask what happened?
I think I was stung by a bee.
Where were you stung?
Right here.
Oh yeah, I see the bullseye mark. About how long ago were you stung?
I don't know, like 10 minutes ago.
Okay. So and have you ever been stung by a bee before?
No.
No? Alright. There is a chance for anaphylactic shock to kick in like 15 minutes. Since it's already been 10 minutes, you seem relatively okay to me. I'm just gonna keep an eye out for it, but just know if that possibility does come up, I may have to call EMS. Would that be okay?
Yes.
Okay. Let's start seeing if there's a stinger in there. There is. I'm gonna apply my PPE.
What's PPE?
It's my gloves. and then I'm gonna try to remove this as carefully as possible. Let me know if I'm hurting you. Alright, there's the stinger. I'm gonna get you a Band-Aid and some triple antibiotic ointment. There you are. And here's a Band-Aid for that, just to make sure that no other foreign bodies get into that little wound. Are you still feeling alright, sir?
Yes.
Alright.
Thank you.
There you are. Thank you for being you. Alright. Thanks, Angel.